Hi, Anuj. Thank you so much for joining us. Can you just give an introduction on who you are and what you have done related to COVID this far?
Yeah, my name is Anuj Mehta. I am a pulmonary and critical care doctor. I work at National Jewish Health, Denver Health, and the University of Colorado. So I've spent the past 8 months taking care of COVID patients in the ICU, seeing them and follow up in my office at National Jewish Health. And then also, I've been very active at the state level in crisis standards of care, but also more recently, vaccine planning and allocation for what we're hoping is going to be a highly effective and safe COVID-19 vaccine.
Thank you. Can you tell us why a vaccine is important?
Yeah, so we already have several key public health measures that are going to be really critical for keeping the pandemic in check and trying to reduce the number of cases that we're seeing. We're in another surge. Those are simple things that are already recommended, like to save six. So wearing a mask, staying 6 feet apart from people not in your household, washing your hands frequently. If you're at really high risk, if you have obesity or diabetes or you're older, taking even extra precautions. Staying home if you have any symptoms, and if you're sick, going to get tested. So those things are really critical to trying to slow the spread of the pandemic. But we know that even when people do those things, there's still a slight chance that they could get COVID. So in any infectious disease, vaccines are really critical to try and slow the spread and reduce the chances of an individual getting sick. And then on a community and society level, if enough people get vaccinated, you can actually reduce the spread through community and reduce the chances of somebody who hasn't been vaccinated getting sick. So vaccines are really critical for influenza, chickenpox, measles, mumps, and rubella for kids, and now also for COVID-19.
Well, thank you for your work that you've done and prepping for vaccine distribution planning. Can you talk a little bit about that and about the tiered phases? Who will be getting the vaccine first?
Yeah, so it's still a work in progress. So all the work we've been doing is constantly evolving as we get more information from our federal partners like this Center for Disease Control or the Food and Drug Administration, the FDA, but also as we get information about the clinical trials. So the fundamental goal is that we want to vaccinate every single person that wants a vaccine, and we hope the overwhelming majority of people will want a vaccine, a safe and effective vaccine. But we know that due to limitations on manufacturing in terms of making the actual vaccine, we're not going to have enough upfront. And so every aspect of this vaccination plan is going to be really encroached around identifying critical populations that will vaccinate first. And we had a lot of really ethical principles that we base this on in terms of what's necessary for society to continue functioning, paying back people that are putting themselves at risk, like grocery store workers and transportation workers, protecting our first responders so they can continue going to save other lives, and then also recognizing that some people are at higher risk for severe COVID disease, like ending up in the hospital or even in the intensive care unit. So we developed, here in Colorado, we developed a series of vaccine phases that identify these critical populations. And the goal is to vaccinate them one at a time, and then continue to vaccinate more and more people as we get more and more vaccine. And as of now, as of today, the phase system looks like we'll start with healthcare workers of all types, whether they're in the hospital or out of the hospital, home health aides, long-term nursing facilities, because we know that these individuals are, one, putting themselves at high risk for being exposed to the virus, but also that there's necessary to keep other people safe. We don't have a functional healthcare system and somebody gets sick, there's nobody to take care of them. So healthcare workers are at the top of the list. Similarly, first responders like firefighters, emergency medical personnel, our public health officers who are doing contact tracing, and police officers are necessary to keep society functioning. And then we prioritize the people that are at the highest risk of developing severe disease or even dying from COVID, and those are our nursing home residents. We know that they tend to be older, they tend to have more diseases, underlying conditions, and if and when they get COVID, we know that they have the highest risk of dying. And so vaccinating them early in the plan is going to be really critical to reducing the number of people that end up in the hospital and the number of people that are dying from COVID. Once we do those critical populations, that's what we call phase one, we move into phase two, and that's broken out into two categories. So phase two are other essential workers who are exposed to the public, like grocery store workers, teachers, childcare workers, public transportation people, The list is endless about these individuals who are putting themselves at risk through their very job, and they are essential workers. We need to get food. We need to be able to have our kids in school. So vaccinating them early is going to be really critical, as well as people that work in high density settings. So like our meat packer industry that was decimated early in the pandemic. So vaccinating those individuals would be really critical. And then phase 2B is our people at higher risk. And so this is constantly evolving as we learn more about who the virus affects, but adults over the age of 65, those with diabetes, obesity, heart or lung conditions, cancer, people with weak immune systems. So we'd want to vaccinate them kind of before we get to what's phase 3, which is the general population. And so throughout the entire phases, it's based on these principles of protecting the people that are necessary to keep society functioning, like nurses and respiratory therapists and pharmacists and doctors and police officers, but then also trying to identify who's at the highest risk of getting sick and getting really sick from COVID. So it's a balancing act. And, we spent a lot of time developing this plan. We've modified it several times, and we've taken cues from federal partners in terms of developing it. But we've tried to have a very clear focus on Colorado in developing the Colorado plan.
Thank you to you and to everyone else who was involved at the state level in creating this plan. You can tell just hearing you talk about it, how much work went into that. I also wanted to thank all of the people putting their lives at risk to keep society functioning, to keep healthcare functioning and all of that. I know you spoke a little bit earlier about what people can do now to prevent the spread of COVID, even before vaccine is distributed widely. Can you talk a little bit more about that?
Yeah, I think it's really critical for everybody to realize that the way to fight this pandemic does not mean waiting until there's a vaccine. There is a lot that we as individuals and we as a society can do right now, today, to decrease the number of people ending up in the hospital. And those are the public health measures that you've been hearing about. So wearing a mask when you're around anybody that's not in your household, wearing that mask is going to be really critical to protecting yourself, but also protecting you from spreading the virus if you happen to have it to other people. Staying 6 feet apart from people not in your household, whether you're inside or outside, obviously much more important inside, but even outside, that social distancing is really critical. Washing your hands frequently, and so that's either soap and water for 20 seconds or hand sanitizer for 20 seconds or until they're dry. If you are one of those people at higher risk, so if you're older or you have diabetes or a heart or lung condition, taking extra precautions, really regulating who you're coming into contact with, because we know that you are more likely to get sick. And then if you start to feel you have any symptoms, please stay home. Don't go out and be in the community, call a friend to get you groceries if you need to, but stay home, with the one exception of if you're sick, also go get tested. Because it's really critical to know whether or not you have COVID. Some people that are getting sick with some fevers and chills, they could have something else like, a cold or the flu, or they could have COVID. And knowing whether you have COVID is really critical for the other public health measures that we implement, like recommending quarantine, protecting your friends and family. So those 6 things, what we call the safe 6, wearing a mask, keeping 6 feet away, washing hands, making sure that if you're high risk, you're doing extra things to keep yourself safe, staying home if you have symptoms, and then getting tested if you have symptoms are really critical. And even now can slow the spread and reduce the number of people that are ending up in the hospital, which as of today, our hospitals are overwhelmed with COVID-related diseases and are really bursting at the seams.
Thank you. And I know there are some people out there that don't take COVID seriously, don't think it's real, and you're working directly with these patients. Can you give a little insight to anyone who might be viewing this on what it's like and if it's real?
Yeah, COVID affects everything I do every day of the week on a professional level. I work in the intensive care unit, I take care of patients, and I see the fear in their eyes as they're struggling to breathe. I see that how they want to be helped, and we're doing everything we can to try and take care of them. I see the fear in the faces of family members when I talk to them over the phone or via Zoom or some other video conferencing, fundamentally because they're not allowed to be in the hospital. And then I've held the hands of people that have died when their families couldn't be there because of COVID. And we really believe that nobody should die alone. And so I've cried over these patients when I know that that I wish there was something more we can do. And, this is something that affects us on a daily basis where we work. It's, when I look at the nurses in the hospital and the respiratory therapists who are there much more even than I am, you see the emotional strain that they're feeling from having to take care of so many people that are sick. And where the most common lifeline, meaning their family, is just not there to provide support. And sometimes those connections are really important even to us as healthcare workers. And not having family there is clearly beyond difficult for patients and family members, but it's also difficult for healthcare workers because we rely on those relationships to kind of humanize everything that we do. And so it's been really, really hard. But COVID also bleeds into my personal life. I have a wife who's a healthcare worker, and I have 2 kids. And when I'm working in the ICU, I try and stay away from them as best as I can. I have to try and explain to my young children why we have to wear masks and why it's so important. And they wear masks, so when we're out and about, and they'll remind us if we forget. So they're pretty amazing. But COVID affects everything we do, and it keeps me up at night. It's one of the first things I think about when I wake up, because it's just pervasive, and it's affecting the fabric of our society on a level that I think nobody ever even expected. And for people that don't think it's real, I have a message to them. If you don't think COVID is real, then I invite you into my intensive care unit, and you can come hold the hand of a patient who's dying when their family can't be there. I'll give you gloves and a mask and everything, but as you watch somebody die alone, then tell me that it's not real. And if you think it's not real, I invite you to do that, because that's the reality of where this pandemic is taking us.
Thank you. That's so powerful and personal, and I feel the message. And thank you so much for your time. Thank you for all of the work you're doing. The Aurora Health Alliance is very grateful, and we'll try to help spread this message.